Hello friends, I am Dr. Rahul Patil, consultant cardiologist, Ruby Hall Clinic, Pune. Recently, one of my friends told me an incident which happened in his society and his neighborhood. A very young gentleman had discomfort at 2 o'clock midnight, and he had discomfort. Suddenly he went unconscious. By the time ambulance came, took him to the hospital, he was declared dead. It was a very shocking incident for everyone, and as a society members, they could not help their neighbor. And that's the reason why he asked me, "Sir, tell me something, primary care where someone gets a heart attack or event, how could we help as a common man to this gentleman?" To understand more about this, I thought it's not only for you, it is for whole population across the world. How should we understand that someone is undergoing a heart attack? And how can we prevent his sudden death? First of all, you need to understand the symptoms of heart attack. A chest discomfort which is absolutely in the center of your chest, which presses your chest, causes heaviness, severe discomfort which can radiate to your shoulders or left arm or jaw, or neck, maybe choking sensation. Along with that, you may get breathing difficulty, profuse sweating. If over a period of time, if the symptoms are increasing, then this is a thing which you need to know that this could be a heart attack. It's very common in families if someone has diabetes, blood pressure, or smoking. Once you know that this is a heart attack, you have to be cautious. First thing, because of this panic situation, most of the people are fearful, and because of fear, they are not breathing normally. They may hold your chest and then just hold their breath also. So ask patient to relax first of all. Tell them to take deep breathing. It's very, very important. Because of inadequate breath, oxygenation will be inadequate and which can cause sudden cardiac death. First hour is extremely crucial because that is the time when most of the people, they die of arrhythmias or abnormal beating of heart. You should have some emergency ambulance number or a hospital nearby so that you can call these people for your help. Till that time, ask your patient to comfortably lie on the floor, not on the bed, because floor has a hard surface, and if something goes wrong to the patient, then that is a time when you can be extremely actful. Second important thing, it has been seen that if you cough during this event, it will help your heart to increase blood supply to your heart. It will also increase your blood pressure so that your heart gets adequate blood. And third, it also increases your heartbeats. So it has been seen even during my angiography and angioplasty surgeries, if someone suddenly drops his blood pressure or gets cardiac arrest on table, or if someone has a fall in pulses. So in that case, we tell our patient to cough, and this cough, a simple cough technique, if patient repeatedly does it, it increases blood supply to heart, increases your blood pressure, it increases your heartbeat, and with this, patient stabilizes. There are patients where the blood clot which has been blocked in the artery has also opened up because of expulsive coughing. But unfortunately, if your patient suddenly arrests in front of you and becomes unconscious, the most important thing is you need to look at his pulse. If the pulse is not palpable, many of you now because of COVID have pulse oximeter at your home. You can put a pulse oximeter, you don't see any reading. Then the most important part here comes with CPR. So CPR is a simple technique where you compress the chest of your near one and you press so that patient gets adequate blood supply to brain and patient is survived. A good adequate compression of chest has saved 50% of people in their cardiac arrest situation. So you need to learn how the CPR is done. By the time the help comes for you, you should also arrange someone who is next to the keen to do CPR after 5 or 10 minutes, because after 10 minutes CPR become inadequate because the pressure required for compression of chest is significant and you get tired by that time. Unless you get a D-shock machine, the patient is not going to survive, because in the first hour it is ventricular fibrillation which is the cause of sudden cardiac death. So you need to have a DC shock machine. So I believe in near future malls, multiplexes, maybe some societies can also purchase a DC shock machine which can immediately automatically deliver a shock to the person and can save the life. Today we are also aware that we have got a CPR automatic machines which can be put to the patient and it can automatically deliver CPR so that patient is survived by the time he reaches hospital. So these are some of the very important messages which need to be passed across so that everyone understands some basic primary aid for management of heart attack. If you want to know more about this, you can call us or you can visit our clinic. Thank you.